Mr. President, the Senate has been digging in to the legal quagmire of drug testing the unemployed, and I'd like to begin by saying that no matter where a senator comes down on the issue of drug testing, my view is this measure before us is simply bizarre. If, like me, you believe that drug testing can, in instances, be ineffective and mean-spirited, you ought to oppose this measure because it simply vilifies unemployed workers who are actually less likely to use drugs than the general population. For those senators who support drug testing, this measure blows up what has been a bipartisan compromise and a Labor Department rule allowing the testing to go forward. And as a result of this measure passing, it would actually block testing from going forward. The fact is, the courts have ruled that suspicionless drug testing violates the Fourth Amendment's protection against unreasonable searches and seizures. That's why there is now actually a rule that is narrow. So, Mr. President, we've got the courts expressing skepticism about this, and there's actually a rule that is narrow so that, in effect, states that are doing this drug testing have what amounts to guardrails to avoid running afoul of the Constitution. If you pass this measure, you throw out the guardrails, opening up, in my view, the possibility of yet more litigation on Fourth Amendment grounds. Now, as I touched on in my opening comments, there isn't evidence that unemployed insurance recipients use drugs any more frequently than the general population. In fact, studies actually indicate that they are less likely to use illegal drugs than the general population. So this idea that somehow there is a presumption of irresponsible conduct and guilt is just baseless. Now, to be eligible for unemployment insurance, workers have to have substantial recent work experience. They've got to be unemployed through no fault of their own. Workers can collect and only collect unemployment benefits if they're actively searching for work and available to work. For states that have implemented drug testing policies, there's evidence that the costs dwarf the potential savings. The costs of operating drug testing programs are charged to state health and human services accounts, and I think we all understand those have been squeezed mightily by the effort to treat opioid addiction. In my view, instead of wasting money by drug testing Americans who are looking for jobs, the state and the states ought to be putting those very same dollars towards substance abuse treatment, given the fact that opioid addiction has hit our country like a wrecking ball. Moreover, I would say, and we've said that fighting opioid addiction ought to be a bipartisan cause. If Republicans wanted to do everything possible to fight addiction, they shouldn't be going forward with Trumpcare, a bill that would be a disastrous setback when it comes to fighting opioid addiction. And the fact is, colleagues on the other side of the aisle, Mr. President, here in the Senate, colleagues not from my side, colleagues from the other side, have expressed their concern about what Trumpcare means for the fight against opioid addiction. The hard numbers are actually out now on Trumpcare, and they show that the majority is going into overdrive to pass a bill that strips millions of Americans of their access to treatment for substance abuse. Today, Medicaid is strengthening our mental health network, and substance use disorder treatment is expanding access and is at the front of some promising new work to fight opioid addiction. So Trumpcare hits the cause of treating opioid addiction in a devastating way. It slashes the healthcare safety net, and in my view, it would inflame the epidemic of drug abuse deaths across the country. Now, at the same time, there's this partisan effort to slash funding for addiction treatment. Republicans have dredged up an old head-scratcher of an argument that drug testing Americans and denying them earned benefits somehow just magically helps to overcome addiction. This is an important point. Just like Social Security, unemployment insurance is an earned benefit. It is an earned benefit, Mr. President, that ought to be there for workers who fall onto hard times. So what the majority is pushing for in this debate looks to me like light years away from what was discussed last year when there was discussion before the election about helping Americans in every part of the nation who are struggling with opioid addiction. And you have to ask the question, what earned benefits are my colleagues on the other side of the aisle going to crusade against next? Is the drug testing crusade going to turn next to Social Security and Medicare recipients as an excuse to deny seniors benefits that they have earned benefits that they worked hard for through a lifetime of work? And I'm going to wrap up, Mr. President, by way of saying that if this measure passes, I think that states are just going to be thrown into bedlam. The current law, based on a compromise, a bipartisan compromise reached in 2012, says states can drug test recipients of unemployed benefits. First, if unemployment insurance recipients lose their jobs for a drug-related reason, and second, if the unemployment insurance recipient is applying for a type of occupation that requires drug testing as defined by the rules of the Department of Labor. So let's say, for example, 2 unemployment benefit recipients are specifically applying for jobs as school bus drivers or air traffic controllers. The rule that is on the books now says that the states can drug test those individuals because they are applying for work in occupations that require drug testing. Now, as far as I can tell, my colleagues on the other side of the aisle want to eliminate the rule that defined those occupations. So states would be blocked from performing any occupation-based drug testing for unemployment recipients. And the states would just be walking into a legal minefield if they wanted to go ahead with testing programs anyway. So make no mistake about it, when this passes, if it does, drug testing policies go on hold until the Congress passes a new law, rather than our continuing a carefully put together bipartisan compromise of just a couple of years ago. So I've been trying to see this from my colleagues' perspective. I have listened to the arguments from the other side, and I just find this a baffling, bizarre kind of analysis. All this measure does is create a huge amount of new uncertainty. That doesn't strike me as a good way to reduce bureaucracy and make government more efficient. If the majority decides to take another crack at this issue down the road, I can only guess at what kind of new ideas they might have then that would again miss the point of making sure we had a narrow, defined, and bipartisan approach to deal with this issue. My view is this is a ill-conceived campaign against working people built on a completely false premise. The premise is if you're looking for work, you're guilty of drug use until proven innocent. My view is we ought to keep trying, as I've said, on major issues involving health and taxes and infrastructure and trade. When you're dealing with important questions, work to find the common ground. It's not about taking each other's bad ideas. It's about taking each other's good ideas. And my view is what was done a few years ago was a good and narrowly tailored bipartisan idea. What the Senate may choose to do is basically throw that in the trash can, create bedlam, make it impossible for states to move because they are in a sort of legal limbo, and I don't see how that meets the test of sound policy. The legislation, this measure before us today, sets back the cause of strengthening the unemployment insurance system. It sets back the cause of advocating for Americans struggling with addiction. I urge my colleagues to vote against this measure when we vote here in a little bit, and I yield the floor.